Great, thank you. Well, good afternoon, everyone, and welcome to Trust for America's Health's Age-Friendly Public Health Systems May training. We're happy you're here to join us today to learn more about how the public health sector can support older adult health and well-being, and today to talk about partnerships and collaboration across the age-friendly ecosystem. I'm Megan Wolfe, and I'm joined today by my colleague, Dr. Karon Phillips, as well as our friend and colleague and partner, Jody Hsu, as well. And our age-friendly public health systems movement would not be possible without the generous support from and partnership with the Johnny Hartford Foundation. Thank you, Jane. I see that you're on here today, so good to have you here with us. Can we go to the next slide, please? So as I mentioned at the top, we would appreciate if you keep your devices muted during our presentation today so we can avoid any background noise. Do feel free to put any questions or comments in the chat throughout the presentation today. And today we'll be asking you to participate with us through some polling questions that we hope will stimulate some interesting discussion, and hopefully we'll all learn together. Next slide. All of our AFPHS trainings are recorded and the slide deck is shared with all who have registered after the training. If you're using an AI note-taking tool, please let us know by commenting in the chat before we begin speaking. In addition, you must be present in the training with the AI note-taking tool. Notes generated from any AI tool can only be used for personal use. Next slide. Your feedback is very important to us, so we ask that each participant take a few moments to complete an anonymous feedback survey that will appear on your screen at the end of the training. Your insights will be shared with our evaluation partners at the New York Academy of Medicine and will really help us to enhance our future trainings. All right, next slide, and we'll start getting into it. So as most of you know, Trust for America's Health, or TFAH as we're commonly known, is a public health policy research and advocacy organization, a nonprofit dedicated to optimal health for every person and community. We produce several reports annually, including our Ready or Not report, which just came out in April, I believe, maybe it was March. I know we did the training on it last month, which that one focuses on emergency preparedness in state public health departments. And then our Pain in the Nation report, our 2025 report, will come out on May 29th. And then with regard to our aging work, we do publish reports and briefs on several topics, and we have them on our website, including those on housing and aging in rural communities. And the one you see on the screen here is the alignment between the 10 public health essential services and our AFPHS 6Cs framework. So you can find that at afphs.org. Next slide today. So today you're going to be hearing from myself and Karon and Jody. And Jody has many years of experience leading and participating in a number of age-friendly efforts. She's been working with us for about 1.5 years now on the age-friendly ecosystem work. So we're really happy to have her join us today. This year, our AFPHS training series primarily is about the age-friendly ecosystem and the public health's role in helping advance multi-sector engagement, and what are some of those strategies and who are some of those partners. So as we continue with our training series on the ecosystem today, we're going to be sharing content that Karon, Jody, and I had the pleasure of both creating and helping to shepherd and bring together. So as you're listening and learning today, please keep in mind the various sectors and some potentially unusual and innovative partnerships that you might already have or that you might be thinking about that could be part of or may in the future be part of an age-friendly ecosystem in your jurisdiction. Okay, next slide, please. So TFAH was asked about 1 year ago by the American Society on Aging to guest edit a special issue on age-friendly systems of care. So we thought about this, and we thought, let's do this, bring together a number of articles and a focus on the age-friendly ecosystem. And so we decided to call it the promise of an age-friendly ecosystem, because we truly believe that there is so much promise in opportunities for collaboration. We can't do this work alone. We have to do this together. We wanted to provide the depth and the breadth of the variety of sectors in the ecosystem, the history and context of the ecosystem, challenges and opportunities, with some case study examples, a focus on equity and rural, and a call to action. So during our presentation today, we hope that you will get, we're going to give you just a taste of some of the content, and we'll be facilitating more in-depth trainings on some of the content, some of the articles throughout the rest of this year. Jody is going to provide a little bit more of a deep dive on one of the topic areas on age-friendly workplaces, which is an area that we're all still kind of exploring. But you can find all the articles from the special issue at the website address that you see on the screen. And Karan just popped in a link for you. How convenient. Thank you, Karan. And at this point, I'm going to turn the presentation over to Karan for a few slides.
Thank you, Megan. So I'm just going to briefly outline the content of the journal issue. So again, it focused on the ecosystem, and there's 3 essential sections that you will see once you navigate and explore the journal itself, journal issue, I should say. So the first section focuses on the imperative of an age-friendly ecosystem. So we start with not only the history and the different approaches and some theories and principles related to, but we also talk about some of the impact of health inequities and cumulative disadvantages, the evolution of age-friendly in rural communities and constructs with our colleagues at with the National Rural Health Administration Association. And then we also look at some international perspectives on age-friendly initiatives. So then the second section, if you will, looks at the different systems specifically, so the promise of age-friendly systems. So we start with an overview of age-friendly public health. We look at the adoption of the 4 M's, focusing on the age-friendly health systems, looking at the AARP Livable Communities movement with our colleague Bill Armbruster at AARP. And I should note that the 4 M's piece was written by our colleague at Institute for Healthcare Improvement, Laura Howell Nelson. And then we focus on age-friendly universities as part of our ecosystem, written by our colleague, Dr. Aaron Guest. And then we have the promises for age-friendly workplaces, which Jody Shu will highlight later for us in the training. And then also thinking about communities and our dementia-friendly communities as a catalyst for cross-sector collaboration. And then the third section, creating a harmonious age-friendly ecosystem of care for older adults. So leveraging disability partnerships and policies to advance age-friendly ecosystems, written by Allison Barkoff. We are hoping to have her come on later this year to speak more in depth about the intersection between disability and aging, and also some of the intersection between ableism and ageism as well. Advancing the age-friendly ecosystem, our colleague Dr. Keno White and Dr. Kay Bender shared a key example of what's happening in Mississippi. Understanding this construct in the tribal communities, written by our colleagues in Washington State. State multi-sector plans on aging. Again, how does that fit in with all of the work that we're talking about related to age-friendly ecosystems, and how do those 2 pieces work together, components work together? And then we close and wrap out the issue with creating a harmonious age-friendly ecosystem that delivers, and talking about some summaries, but also kind of looking forward as well. I'll turn it back over to you, Megan.
Okay, great. Thank you, Karan. So what is an age-friendly ecosystem? We have gone through many definitions of what this ecosystem is or could be. And this is kind of where we've landed over the last few months, that the ecosystem is a multi-sectoral network of practitioners, providers, and organizations that prioritize improved quality of life for older adults, their families, caregivers, and communities through collaborative impact. And that part is really important, that collaboration part. The graphic that you see on the slide here includes just the sectors that are actively engaged with us right now. But that doesn't necessarily mean that these are all the sectors that could be in your ecosystem. We were speaking with some partners this morning about a new age-friendly model that is being created that is for an age-friendly, think about faith communities, so age-friendly congregations that would be kind of non-denominational, and think about how we engage with faith communities, because they're a really, really important part of all of our communities, really. So think about, who else, what other sectors do you work with? What other sectors could you be working with, or should you be working with? Who else should be at that table? Next slide, please. And these are just some examples of ecosystems that have become very successful, but are still growing. And you can see that in both Mississippi and Kansas, they've taken the construct, or the kind of skeleton of the circle graph that we have that we created, that actually was created by the Johnny Hartford Foundation, and they've made it their own. So in Mississippi, they've put those sector names on the magnolia, and in Kansas, they did it on a sunflower, which for both of them is very appropriate. In Mississippi, the work is being led by our friend Dr. Keena White at the Mississippi State Department of Health, and includes almost all, if not all, of the categories, the sectors that you see on the petals. And in Kansas, the work is being led by the Kansas Health Institute. We're working with a cohort of public health institutes across the country, and Kansas Health Institute has really taken this work to heart and are really moving forward with an age-friendly Kansas, but leading it from the public health perspective. But they have engaged with all the sectors that you can see on their petals of their sunflower. Next slide, please. So we wanted to just touch on and give you a glimpse into some of the articles. We're not going to cover all of them today, all of the areas of each article of the special issue, because there is a lot, and we really do encourage you to just go and at least peruse and take a look at and bookmark for reading later. But our friends, Doctors Emily Greenfield and Kathy Black, representing the academic or academia, universities and research as part of the ecosystem, wrote this article on age-friendly as a social movement, and kind of giving some background in what is a social movement. And they propose that it's the coming together of large numbers of people to pursue a goal that they believe will improve society. Sounds like an ecosystem, right? So age-friendly as a developing movement can refer to a broad set of efforts, as we talked about, collaborative efforts, to make social institutions and society as a whole more responsive to population aging and inclusive of people as they age. So we feel like this is, they propose this this kind of direction and provided a lot of thought about the ecosystem, and I think it makes sense and it resonates with the directions that we're going. The age-friendly ecosystem, in this sense, offers a shared vision, an aspirational vision of what a society could be, what an age-friendly society could be, in which various social institutions or sectors, as well as person-centered systems, relate to each other in ways that optimize individual and collective functioning as people age. So if you think about all those words together, we're talking about people, we're talking about communities, and we're talking about environments and policies and systems. And so these are some of the characteristics that Doctors Greenfield and Black have identified, characteristics that are part of age-friendly as a social movement, are part of an age-friendly ecosystem, and they are listed there on the slide. So policy, systems, and environmental change, crucially important if you're a social movement and you're trying to affect change and make conditions better for older people. Leveraging relationships, that's so important across every social movement, but particularly, in the age-friendly area, we need each other, and we need to make sure that we're leveraging the strengths of each sector. Thinking about older adults themselves as change agents. Very often we're doing this work and we're making policy and systems changes, and we haven't engaged with any of the people directly that are going to be impacted by those changes. So that's a really important aspect. Addressing ageism, of course, is something that we all want to make sure that we have in the back of our mind, and thinking about even how we communicate about older people, not just as other, but as we are all aging. And then equity and diversity in aging is another characteristic that is really important. And I did want to note the diagram that you see on this slide. It's called the 6 conditions of systems change. But sometimes we think about, there's another term, the waters of systems change is, I think, another way of thinking about this. But it's when you start with, you're thinking about transformational change, requires relational change and requires structural change. So there's a lot more in the article on these kind of theoretical aspects of this work and how we can begin to think about it. I think it's really helpful in terms of where do you want to start and what do you want to think about. I would say that because it's aspirational and because it's some of this is theoretical, that you may not be able to apply it right away, but it's really, I think, very helpful to think about, to incorporate, and just kind of keep it in your back pocket. So next slide, and I think I turn this back over to you, Karon.
Yes. So in another article, again, I mentioned our colleagues at the National Rural Health Association earlier. We're looking at the ecosystem, age-friendly ecosystem in rural areas. And we can ground ourselves in the challenges, but I also like to call them, again, opportunities, but they're challenges. We have the social distance of different things, rural hospital closures, high poverty levels, younger people not wanting to stay in these communities, food insecurity, transportation. We, again, we've talked about these challenges before, but there are opportunities. And again, looking at how we can build ecosystems in rural communities. So we have the National Rural Age Friendly Initiative that is being led by the National Rural Health Association. And the focus is on choosing rural and not assuming that someone's just staying there out of just not wanting to leave. Is that they've chosen to stay there. That is where their home is. That is what they're comfortable with. So this idea of choosing rural. There's opportunities, again, across ecosystem also to align with multi-sector plans on aging. So again, when we're developing these larger plans for state at the state level, to also connect with these multi-sector plans on aging to support rural context as well. Addressing some regulatory barriers can also be a part of how ecosystem can be developed and thought about for rural communities. And community health workers, our colleagues at the Joint Hartford Foundation are engaged with some work in Texas where they are focusing on community health workers and their training as a way to support rural communities through the age-friendly health systems 4Ms framework. And then the National Rural Health Association has an age-friendly initiative resource hub that has a lot of great information, a lot of great resources and tools on that site that are specifically for age-friendly initiatives in rural areas. So we're also, Megan mentioned equitable, healthy aging, and we're continuing to keep that trend and theme in mind. So just wanted to uplift 2 pieces. Actually, these come from 2 different parts of the journal, but wanted to uplift these 2 pieces. So the image on the right is included in the article that focuses on age-friendly health systems, and it is a chart that shows how you can integrate equity into your age-friendly health systems journey. So it talks about understanding the current work in the system and how older adults are represented, making equity central. The age-friendly health systems graphic makes equity at the center, making health equity at the center of our graphic. Examining and targeting disparities. So examining workflows and testing change ideas that address addressing disparities and eliminating inequities. Stratifying the data to understand the disparities. So again, I think if any of you have ever been on the train with me, you all know I'm a bit of a data nerd, but again, we know data tells us a story and provides us with context that we need to know. And then we're focusing on 6 on closing gaps in care. So eliminating disparities with care consistent with the 4Ms framework. Dr. Deborah Carr, I pulled this quote from the article because I thought it was very, very important. I'm just going to read it briefly. Age-friendly initiatives that ensure a coordinated, cohesive, and complete system of care for older adults and that engage professional practitioners from diverse sectors, our ecosystem, are key to ensuring that future generations from all backgrounds, so everyone, equitable access, can enjoy good health, physical comfort, and meaningful personal relationships and have a sense of purpose and dignity in older age. So again, there's actually featuring two articles that talk about equity, but equity is embedded in much of the text in our journal issue as well. And then before we pass the podium, the virtual podium, over to our dear colleague Jody Shu, I wanted to reiterate a point about disability partnerships in the age-friendly ecosystem. So we will have 1 in 4 adults who will have a disability and will age with their disabilities. And many older adults do acquire a disability as they age. And the disability population of older adult population share the experience of both discrimination, being that we're talking about ableism and ageism. So those intersections of that dialogue. Some of the ways that this is being addressed, and there's an example of this featured in the text from Connecticut. There was no image to represent that, but it is talked about in Connecticut. But there's an example of how Connecticut is working with their aging department and their disability department. But the Administration for Community Living updated the Older Americans Act last year for the first time in more than 30 years to include some provisions that facilitate specific coordination between aging and disability networks. So they created this bridging project, and the National Association of Councils on Developmental Disabilities is the awardee of this 5-year project to facilitate this coordination of communities of practice between developmental and intellectual disabilities and aging initiatives. So again, looking at these intersections and figuring out how these two sectors can collaborate more effectively to support older adults with disabilities is a focus of this project. Again, these are all little snippets and little nuggets of the journal that we've been highlighting. So we're going to turn it over to Jody now to talk a little bit more in depth about age-friendly workplaces.
Great. Thank you, Karon, and thank you, Megan and Karon, for inviting me on to talk about this particular sector of the age-friendly ecosystem, which is the workplace sector. So we'll get right into it. The next slide, please, Karon. So what I'm hoping to do in the next few minutes here is basically give you a quick overview of the aging U.S. workforce. Some of these statistics might be familiar, but for others of you, this might be news. And then take you through what it means to be an age-friendly workplace, or sometimes it's referred to as being an age-friendly employer, I guess, depending upon the perspective you're taking, and why it matters that we have age-friendly workplaces and age-friendly employers. And then I'm hoping to give you some very concrete examples of how different sectors of the age-friendly ecosystem are collaborating with workplaces in order to deliver innovative partnerships that can really advance win-win goals that ultimately benefit older adults here in the US. So we'll have a little time for Q&A at the end, and we can go to the next slide. So older adults are a large and growing segment of the US workforce. This is probably not a surprise. The share of workers 55 and older has nearly doubled between 1998 and 2018, and the Bureau of Labor Statistics projects that this trend will continue right through the end of this decade, at least, when we expect that roughly 1 in 4 American workers will be 55 or older. So 25% of the American workforce will be 55 or older. The CDC notes also that employment of workers age 65 and older, so even a little bit older, has increased by roughly 117% over the past 20 years. So these are pretty startling figures, and they have implications for both employers and older adults. On the employer side of the equation, the shrinking pool of younger workers necessitates reliance on the older workforce and possibly some rethinking about how they recruit and retain those workers. And on the older American side of the equation, their continued participation is really essential to meet labor demands and support economic growth in the communities where they live, never mind the social piece of the puzzle, which we'll talk about as well. Next slide, please. So you may be familiar with some of this rollout of various age-friendly initiatives over the past couple of decades. And really, so much of this has come in response to this demographic shift that's happening broadly here in the US and elsewhere around the world. In 2006, the Certified Age-Friendly Employer Program was launched, and its purpose was simply to recognize organizations that were supporting employers who were 50 and older. And it happened sort of concurrently with the growing recognition, both here and abroad, of the necessity of meeting and understanding the needs of older individuals where they lived. The World Health Organization introduced the Age-Friendly Cities Framework back in 2007, and then launched here the Global Network of Age-Friendly Cities and Communities, which is now run by the AARP here in the US. In 2012, the AARP also launched its own employer pledge program, the goal of which was to promote age diversity and the value of experienced workers, recognizing what was happening with this labor force, workforce participation demographics. Next slide, please. So what are age-friendly workplaces? What are some characteristics? You probably have a sense for some of these characteristics, but they're worth highlighting. They tend to focus on inclusive environments where age is specifically not a barrier to hiring or advancement. That's an important piece of the puzzle. And Megan and Karon are often and always talking about ageism and efforts to combat ageism. And you can see that it becomes incredibly critical when you think about workforce and employment issues. Employees are valued based upon their skills, experience, and contributions rather than their age. Flexible work arrangements are often a component of an age-friendly workplaces. Things like adjusted schedules, shorter or fewer work days. Generally speaking, policies and practices that support the employability of people 50 and older. Age diversity is prioritized in age-friendly workplaces, meaning that the employer is really thinking about how they can leverage the complementary strengths of different generations. So sort of some of the old tropes about younger people being a little bit more technologically savvy may or may not be true, but they can bring that savvy to an older workforce, just as the older members of the workforce can bring wisdom, institutional knowledge, lots of different factors that we're all aware of to enhance productivity. The idea that age-friendly workplaces provide meaningful employment and competitive pay. This is really important as we think about sort of the financial implications of stopping working. And we're going to get a little bit into that topic in a later slide. Encouraging intergenerational knowledge transfer. I can't stress how important this piece of the puzzle is, but this is an important and growing concern for employers because we know that workforce turnover and retention problems are huge headaches for employers. And so thinking about how they can tap into a loyal, consistent workforce that really can bring a long career of skills to the party. And then ultimately reducing age bias. We talked about that above, this issue of thinking about how we combat ageism broadly speaking in society, but specifically in the workforce. Next slide, please. So the business case, why do we care about this at the employer level of the equation? Well, number one, filling hiring needs. We know that there's a workforce deficit. And so filling hiring needs becomes crucial for employers. They really appreciate the experience and expertise that older employees bring to the equation, decades of professional knowledge, problem-solving skills, communication skills, you name it. Never mind a known and recognized strong work ethic and reliability. So surveys and research show that employers find that older employees often model commitment and quality, which are skills that are they're able to mentor to younger employees. And that's hugely important as well, particularly as we move into so often hybrid models of work or fully remote models of work where younger employees are not getting access to those in-person learnings that they would have otherwise in previous generations. This gets to mentorship. Older workers can mentor younger staff, follow and foster that knowledge and skills transfer and organizational stability. And ultimately, diverse perspectives matter. So a diverse older workforce really, the research shows, enriches workplace culture, innovation, and overall effectiveness. Next slide, please. But it's not just the business case that matters. The social case for age-friendly workplaces matters as well. I mentioned the economic security mandate here that we're thinking about when we think about age-friendly workplaces and the opportunity to provide continued support, professional growth, and financial stability for older workers living longer lives. So 1 in 3 adults age 65 and older are economically insecure, meaning have incomes below 200% of the federal poverty level. And that's a huge problem from a societal perspective. And so workplace placements for older workers really cut into that and address that issue of economic insecurity. Notably, economic insecurity is higher for older adults of color. 43% of Black and 44% of Hispanic adults age 65 and older experience economic insecurity. So workplace opportunities for those populations is critically important. Flexible work arrangements found in age-friendly workplaces also help to balance personal caregiving responsibilities, which are so often found among older workers, particularly in the 55 and older community, where they may have ongoing childcare responsibilities or care responsibilities for their own parents who are still living. And ultimately, these practices can really help improve well-being and reduce risks of concerns like isolation and depression, which can be often linked in the research to abrupt retirement. Next slide. Sorry. And social isolation and loneliness, I just want to put a fine point on that one because I think that many people understand, the issue here and its critical importance. In fact, the U.S. Surgeon General in 2023 declared loneliness and isolation a national epidemic, and some studies show that social isolation is a health determinant equal to smoking 15 cigarettes a day. About 24% of Americans 65 and older are socially isolated, and 43% of adults 60 and older report loneliness. So you think about sort of the health implications of loneliness, things like early mortality, dementia, depression, chronic disease, and the ways that employment and workforce opportunities can really make a dent in those problems by providing, obviously the financial upside, but also the socialization upside and the ease of addressing loneliness. Notably, I think this was a really interesting statistic. Social isolation among older adults can add upwards of $6 billion in Medicare spending annually because of the health issues that it can bring on. Next slide, please. But the community case, I like to sometimes just zoom out and think about broadly when we think about our communities. Age-friendly workplaces have the potential to make a huge impact. Communities at large benefit when older adults remain employed and they contribute through their tax contributions and consumer spending to retail environments, restaurants, and the community at large. Ongoing workforce participation by older adults also helps reduce pressure on Social Security payments as people push out their reliance on Social Security and other community support services. And then finally, this issue of intergenerational workplaces promoting knowledge transfer and mentorship. It has a huge and positive impact on younger workers at the beginning of their careers and in the early years of their careers when they can learn from folks who have been in the workplace for, and sometimes decades. Next slide, please. So I want to talk specifically about a few case studies. 2 of them are found in the journal article that we've been talking about here today, specifically the workforce article. So there's more information if this interests you, but I want to talk about 3 examples, 2 found in the journal and 1 that's not in the journal. And I tried to just give you the bullet points so that you can jumpstart your thinking about the ways that you might broaden your own ecosystem wherever you're doing your work, to think about employers in your network or employers you wish you were in your network and how you might partner with them. So Shutterstock, you might have heard of Shutterstock. It's a global media technology company. It's based in New York City, provides digital content, high quality digital content, including things like images, videos, music, and 3D modeling. A few years ago, Shutterstock joined the AARP's Employer Pledge Program and began to work with them to think about how they could help foster a more age-friendly environment and other ways they could take their core competencies in media and technology to address some of their employee recruiting and retainment issues. They began in partnership with AARP to develop internal training programs, for example, to address age discrimination. They have an employee resource group called Seasons that specifically supports older adults in the workplace at Shutterstock. They also began a whole upskilling program for employees. So things like events and career development sessions focused on AI and other topics that would be of interest not just to older workers, but certainly to older workers who want to stay relevant as new technologies are emerging. And it also provides a nice opportunity for multi-generational engagement in the workplace, because younger workers want to join these career development sessions at the same time. So it really puts people together and then fosters opportunity for that kind of intergenerational transfer of knowledge that can be taken to other aspects of the business. Really interestingly, Shutterstock joined into a content collaboration with ASA, and the focus of that collaboration was to improve representation of older adults in marketing imagery. So we might know Shutterstock for their downloadable images that can be used in marketing initiatives, but their goal in working with ASA was to try to guide how aging is portrayed more positively and vibrantly in marketing materials, and to provide a fuller look and a more comprehensive and positive look at the older adult experience that users and companies and marketers could download. So that's Shutterstock, sort of one example of a partnership between AARP in this case and a private employer. Next slide, please. And the state of Maine is another. This is really interesting to me. The state of Maine is, in fact, the oldest demographically state in the country. The population of people aged 65 and older is expected to increase and reach 29% of the state's total population by 2035. It is the oldest demographically in the US. But importantly, from an economic development perspective, the state needs 75,000 more workers by 2030. So you have a state with an aging population, not a growing younger population, but a really significant demand for workers. And they recognize in the state government that older workers and multi-generational work teams are key to its workforce development strategy. They know through the research that the number of jobs held by individuals 65 and older has increased from 2013, when it was at about 32,000 individuals in the state, to 53,000 in 2023, which represents about a 67% increase. So they're really focused on identifying an older adult who's an eligible worker, and to reducing barriers to employment and retention of those workers, so that they can promote the kind of age diversity in the workforce that isn't just nice for the older workers, but really critical to the workforce development needs of the state. And I don't mean state government alone. That includes, retail and restaurants and all of the different components of the workforce need for the state. Next slide, please. Next one. Yeah, great, thank you. So in 2022, Governor Janet Mills, been in the news lately, created the Cabinet on Aging to work on some core issues to the state's long-term sort of outlook, economic outlook. Those included things like affordable housing, long-term services and supports, financial security, and engagement in employment in Maine's economy. So this is a hugely important initiative. That's a whole of government initiative. The cabinet itself is co-chaired by the Commissioner of Maine's Department of Labor, which is a reflection of the importance of this employment issue for the state of Maine. The key One of the key focus areas is the engagement of older adults in active retirement by supporting employment and volunteer opportunities for those older adults throughout the state. So next slide, how did they do this? A few things. The state of Maine offers a virtual training that is focused on age positivity to all Maine state government employees in the executive branch, which is a testament to sort of the importance they're placing on this at the executive level for a whole of government approach. The state's Bureau of Human Resources administers 10 employee resource groups with retention in mind. One of them is an age positivity group for older adults, and another is an ERG that's focused on employees of all ages who are family caregivers. So that's an important piece of the puzzle as well. They've partnered across Maine to try to elevate this issue. One of those partnerships is a collaboration with the Maine Council on Aging, which is an organization that incorporates about 130 different organizations, businesses, municipalities, and older adults themselves to provide trainings throughout state government on recruiting, hiring of older workers and inclusive workplace environments. Like, what does it need to be? What does it need to look like in order to both recruit and retrain those older workers? They've also developed a leadership exchange program on ageism specifically focused on training government leaders to identify and address age-related bias in the workplace, because they recognize that has a huge impact on the recruitment and retention that I was referring to. And then notably, the state itself joined the Certified Age-Friendly Employer Program to ensure that its work promotes and, in fact, supports an inclusive workforce. Next slide, please. Both of those examples, Shutterstock and Maine, are in the article, but this one isn't. And this is a really interesting example that I was able to find about employer or workforce and local public health department partnerships for older workers. So this is a partnership coming out of Michigan. Vantage Plastics is a Michigan-based manufacturer, and they partnered with the Michigan Health Improvement Alliance in partnership with the Michigan District Health Department to develop a partnership that would be a win-win. Vantage Plastics, the manufacturer, was experiencing high employee turnover, and their workforce included older adults. So turnover and also recruitment in order to meet their manufacturing needs. The public health partners were focused on improving access to health services that were available in the community. So they came together and developed an on-site support strategy that involved Vantage, in fact, hiring a community health worker directly at their facility to focus on chronic disease management, mental health services, and social determinants of health, areas that are all especially pertinent for older workers. In terms of outcomes, this program delivered nearly $1 million in cost savings for the employer, Vantage Plastics, and delivered an 18% reduction in employee turnover, basically delivering a win-win for both the employer and the public health practitioners in the area, which was able to improve access to these health services that really mattered for this workforce at Vantage Plastics. So those are 3 examples. Next slide, please. Just some key takeaways that I'll leave you with, and then I'm happy to answer any questions if we have time for that. We know that age-friendly workplaces can and do support and enhance the broader ecosystem movements that are happening all over this country and elsewhere. We're learning, we're continuing to learn how to pull workplaces even more specifically into these public-private partnerships that can be so beneficial. But we know that business leaders can be catalysts for change in other sectors of the age-friendly ecosystem movement, because when the business community adopts these age-inclusive policies and programs, it can really trickle down into the community at large. So that's sort of a two-way street. So often these initiatives start at the municipal level or at the health system level or at the public health system level, but it can go both ways. And that's a really important piece of the puzzle. But that they really have the opportunity and the potential to positively impact public health practice, municipal leadership and governance, and also the health systems where they're doing business. So I just hope that I've been able to give you a quick overview of this age-friendly workplace initiative and prompted you to think a little bit about how you might think about business leaders and employers in your own communities and see about pulling them into the work that you do for the betterment of older adults where you're operating. So thanks for listening.
Thank you, Jody. That was so helpful to kind of get that perspective. But then those case examples, I think, really provide the examples and inspiration for folks to take away and into their work. So we can pause here and see if there are any questions for Jody at this point.
Megan, if I can ask a quick
Sure,
question,
Jane.
Jody. Yeah. This was so great, the webinar as usual. So Jody, I might have missed it, but it seems like a workplace is both how to retain and recruit workers in the workplace, and then on the other, not on the other side, but along with that is how to attract consumers.
Yeah.
So
Absolutely.
wondered, yeah, how those two play out or play together.
Yeah, I think it depends upon the employer. Like every employer is going to come at this through a different lens, but certainly, we know that age diversity in the workplace helps you think differently about your customer base because depends on what you're trying to sell and who you're trying to sell to. And certainly when we have diverse products and services that are being pushed out into the market, it really helps to have employees who speak the language and understand the target market. So for sure, that makes sense. Retail for sure. So it's really multifaceted. It's thinking about how do you recruit and retain the kinds of workers that you need to think about maximizing your business potential, but also working with employers to help them broaden maybe their thinking about what that involves, because obviously age bias is no secret to any of us, and really helping to work with employers to help them see what you know, Jane, and which so many people know on this call, but isn't always intuitive to employers who might not be thinking about older workers as a really important and available source of talent in their communities.
Great question. Thanks, Jane. Thanks, Jody. Any other
Thanks
questions?
for bringing that up, Jane.
Yeah. Or responses. I'm curious how many, if any of you have thought about partnering with businesses or industries in your communities on age-friendly ecosystem efforts. I was participated in a meeting yesterday with some folks in South Central Tennessee, where the Jack Daniel's Distillery is located, and folks from the local health department there went and did a health fair in partnership with the distillery. So I thought that was one interesting
That's very
example,
cool.
yeah, of how to partner. All right. Given no other questions at the moment, let's move on. And Karon, if you'll go to the next slide. So we wanted to share this this graphic with you. We call it a poster. Jody, Karon, and I developed this last year along with some other folks as we prepared for an age-friendly ecosystem workshop and some breakout groups that we wanted to focus on. And we'll send this to you. This will be part of the slides that you will receive as a participant in today's session. But we wanted to share this with you so that you could start thinking about what processes might you be already engaged in or working in where you could take advantage of thinking about the whole ecosystem and how to create an ecosystem, how to create those collaborations. So these processes might include your public health, community health improvement process. As you're doing your community health assessment, you might use this kind of a process. You might already have something built in where you can think about different sectors and what they can bring, what their strengths are. The age-friendly communities process is another kind of environmental and systems change process where you could begin to create an ecosystem, and then developing a multi-sector plan for aging, which is happening in more than 2/3 of states. So about 40 states are in the process of developing or implementing age-friendly ecosystem. I will say only a handful, maybe 12 or 13 of those states are actually implementing those multi-sector plans. So the work that you're doing in your communities actually could be kind of the operationalizing of the MPA. And you could use this poster and this process and thinking about what that looks like, and how you can continue to engage in additional partners, and what conditions are necessary. So we designed this to think about a goal, or what change are you trying to achieve, and then what are the conditions that you may want to think about as you are approaching your goal or your aim. And then think about what sectors you're working with, what strengths do they have, which additional partners should be brought in, and then what challenges might you encounter along the way. So I want to ask you to first think about something in your community that you might want to fix, or a change that you want to see, or a system that you want to expand to include older adults. And we're going to do a couple of polls. So I hope that you will be ready to participate, and then we'll have some discussion around some of the results. So Karan, you want to go ahead and bring up that first poll? So the question is, what sectors have you partnered with? So there's a QR code in the top right corner, so you can use your phones to capture that QR code, or you can go on to the web site there at PollEv, so poll everywhere, pollev.com/AFPHS for AFPHS. And then what sectors have you already partnered with as you're thinking about your age-friendly public health systems work, your age-friendly communities work, your community health improvement work, or your multi-sector plan, if for those of you who may have those already happening in your communities? I don't see anything coming up yet. Is everybody able to access that QR code? Are we able to test that and see if it's working?
I'll try.
Oh, it's too small. The QR code's too small. Well, how about popping them into the chat? Let's do it that way. Yeah, it doesn't seem. Oh, there we go.
Oh, we got it.
Okay, all right. So addiction, local services. I'm not quite figuring out what some of those words are. Keep them coming, but please do put them in the chat as well. So we can start the conversation that way. So aging services, I think, local, I don't know what BOH is. That's interesting. Libraries. This is something that we're hearing more and more, is how important the local library is to engage with, because that's where you're going to find a lot of older people who will be using those services. So universities, awesome. Nonprofits, faith-based, absolutely. We're talking more and more about the faith community and how important that is. Safety and emergency preparedness, of course, is a huge partner in thinking about how do we make sure that older people are considered in emergency situations. Addiction, so kind of the mental health and transportation. I love that one. Security, just the county government, law. So thinking about protecting, so adult protective services, right? And thinking about the legal system and how we protect older people from scams and those kinds of things. So I hope you all are getting some ideas even from some of these, but I'm really impressed by the number of different sectors that you all are already engaged in. AARP, of course, someone says, oh, thank you, Maddie, for putting in. Maddie put a comment in here about the MAP 2.0 process, which is the National Association of County and City Health Officials Community Health Assessment process. Is called MAP, Mobilizing for Action for Policy and Partnerships. I think that's right. And that process requires you to have focus groups and to really engage across the community. So that's a great idea. Thank you, Maddie, for putting that in there. Local senior centers, local health partnerships, police and sheriff department in small towns, absolutely. Libraries, yes. Great ideas. Mental health services, so important. And the Alzheimer's Association. So if you have a local chapter of the Alzheimer's Association, they're wonderful. We work with them, of course, on the national level, but we feel like they're great partners as well. Awesome. All right, let's go to the next one, Karan, the next poll. So we want to talk a little bit about challenges to collaboration, because we want to talk about how we overcome those challenges. So what are the solutions? Silos. Yeah, absolutely. It's a huge one when you think about, we've got one program over here and another program over there, and how do you dismantle those silos? Like, what does it take to dismantle those silos? We were talking to a friend of ours in the Wisconsin Bureau of Aging and Disability, Carrie Mulkey, who leads that bureau. That Bureau of Aging and Disability is part of the Division of Public Health in Wisconsin. So that's one way that they overcome those silos. Cutting of funds and staff, federal funding. We know right now in the environment, it's not really even all about the cuts. It's about the uncertainty, right? Communication, duplication, time and bandwidth, absolutely. Turf protection, Elizabeth. I love that, because it's something that we see and we don't want to name it, right? We don't sometimes want to recognize that that's actually what's happening, is that one sector wants to hold on to their turf, even though they know they could be much more effective if they partner across sectors. Communication, yes, thanks, Jody, saying that's not my job. Somebody else can do that. Bureaucracy, leadership. One of the things that we have learned in our ecosystem work is how important it is to build trust, and we did our February training was on building trust, and our March training was on leadership. Or I could have that backwards. I'm not sure, but we've done 2 trainings this year. One of them was on trust. And one of the things we learned is that you have to have a personal relationship in order to build trust. And the best way to do that is to sit down and have a cup of coffee with someone, or to break bread with them, and ask them how they're doing and how their work is going. And that's just so important to overcome. So other thoughts for how we address some of these challenges to collaboration? And go ahead and just come off mute, kind of, just share with us quickly, or pop them in the chat. How do we overcome these? All right, well, I've shared some of my thoughts. I don't know, Jody, if you have other thoughts that you'd be willing to share. Trust. Thank you, Jane. Yep.
I think leadership development too, and I know you mentioned it because you've done it at your training, but the leadership development piece of the puzzle, really, we've seen in the different workshops we've held with practitioners from across all of these different sectors, that when there's somebody who's really strong and well respected, who really makes it a priority, it's so much more likely to happen.
Yeah, for sure. For sure. All right. Well, we really commend the special issue to all of you. I hope that you will at least take a look at it, kind of glance through it. As I mentioned before, bookmark it for later, for when you have a little bit of time. If you want to learn about one of the sectors, you can learn about all the sectors. So there's just a wealth of information. Dr. Carr's article on the effect of cumulative inequities and the impact that has on older people and how we can address them. Alison Barkoff's article on the importance of considering people with disabilities in our partnerships and making sure that we're inclusive there. So there's just so much knowledge to be had, and we continue to learn so much. And appreciate all of you being here with us today. Jody, thank you as well for your contributions. Really, really interesting. Thank you, everyone, for participating with us in the polls. And Karan, I'll turn it back to you to close us out.
Sure. Thank you, Megan. Just wanted to make sure that you all note we have our June training coming up, but it is not on the 3rd Thursday. It will actually be on June 18th at 3 p.m. The registration link is available under events on our website, AFPHS.org. So for those of you that are interested in our series, you can register for one and register for all, but just please note that next month is not on the third Thursday. And invite you to connect with us. We have a monthly newsletter. Our newsletter just went out earlier today. So please sign up to join us on with our monthly newsletter so we can keep you connected to more of our training information, more of our resources that we share, any upcoming things. And we have lots of things coming out soon. So stay connected with us. I'm certain this QR code works. And for those of you that are pursuing champion recognition, please take a minute to confirm that you have attended this training. If you're viewing this as a recording, please pause now, use the website listed, or use the QR code to indicate that you've attended this training and mark the appropriate information on this training that you've attended. And with that, thank you all for attending.
Thanks, everyone. See you next month.
Thank you.